Hi folks, it's Marvin Music with MedicareSchool.com, and want to welcome you to our live stream event tonight. Those of you coming in through our YouTube channel group, as well as those of you joining us from Facebook. We're glad to have you tonight. Tonight is going to be just a little bit different. I'm going to stick with you and answer lots and lots of your questions, but I am solo tonight. Very rarely this has happened, but all the folks on our team had other commitments, and so I said, I'm pressing on, and I'll do this by myself, and so hopefully this will go well. We will get to all your questions. Grateful for all those of you that participate with us on a weekly basis, so I hope you continue to learn a lot. I do want to give a hearty welcome to those of you that are new to our group. If you're not aware of our Facebook group, we'd love to have you be a part of that. I think there's like 50,000 now in our Facebook group, and YouTube channel, I don't know, 300,000 plus subscribers or so. But we have a YouTube channel for the purpose of providing quality education. I'm about a minute late because I just came out of our studio shooting a video on some of the tax changes for 2025. And so that video will go to edit, and then it will be on our channel here in a week or so. And so great place to go to learn about Medicare. I think we have now 400 and some videos, and we got a couple other people that contribute as well for content. So avail yourself of that. It's just really a great way to learn, and we believe it's important that people make confident decisions when they go on Medicare, and the way to do that is to get an education. You don't have to be an expert, but you better learn some essentials about Medicare. And the last thing I want to say, if you've never gone to our website, every year I do an updated version of a very brief workshop, about 50 minutes in length, but it goes through all the ins and outs of Medicare. We get a lot of good comments on that, so I think if you're really just starting the journey and wanting to learn about Medicare, that'd be a great place to go. That's our website, MedicareSchool.com, and you'll better click on what we call the Essentials Workshop. 50 minutes, and you'll really learn a lot, and invite you to avail yourself of that opportunity as well. Okay, so enough said. We are going to get your questions. Do me a favor. Be sure that I can understand your questions. I know sometimes people try to be real abbreviated, which I understand, but don't be so abbreviated where I don't understand what you're trying to ask me, okay? And we're going to get to all those questions tonight, or as many as I possibly can, okay? And so let's talk about the topic, though, that we selected. Again, I'm just going to take 5 minutes, maybe 7, but not long. And let's talk about the one Medicare mistake that you'll regret the most. Now, there are several Medicare mistakes that people regret, but as we were talking about tonight's topic, I would highlight really the one I would not want to make, and the one I certainly would not want to miss, is this item in Medicare that we call the Medigap OEP. Medigap OEP. It also would be, you could call it the Medicare Supplemental OEP, and that OEP stands for Open Enrollment Period. Now, keep this in mind when we talk about going on Medicare. The first decision that you have to make that is critical is go on Medicare at the right time, folks. That's important. I've seen, people that have not gone the right time and made it's cost them immensely because of the penalties, the problems, all that. So go on Medicare at the right time. So let me just briefly remind you, if you're turning 65, and if you're in one of these 5 scenarios, you have to go on Medicare at 65. You must. Number 1, anyone who's no longer working or your spouse is no longer working, you have no employer plan available, pardon me, you have to go on Medicare at 65. Number 2, anyone that's covered by COBRA insurance. And this is one where I see a lot of mistakes. People get COBRA, it's paid for by the company, maybe 12 months or something, and so they take COBRA, they're already 65, and then they want to come in once COBRA expires, and it's too late because COBRA always goes to the second payer position. That's what you got to remember. When you turn 65, if you have COBRA, it's all right to use it for no more than 6 months. That's the topic tonight. We don't want to miss the Medigap OEP. Never more than 6 months. Now, if your spouse is covered by the COBRA, then you can extend that, but you still are going to have to go on Medicare. And so if you're turning 65 on that 65th birth month, you've got to go on Medicare A and B, and the COBRA then moves to the second payer position. So my point is, if you're eligible for Medicare and you're on COBRA, COBRA will no longer pay first. They move to second. And you enroll into Medicare A and B to put Medicare in the first payer position. But if you don't enroll in A and B, you become the first payer. And I've seen people cost themselves, one lady, $80,000 because of that mistake. So am I saying don't keep COBRA? No. I'm just saying you want to make sure that you're still on Medicare A and B at 65, COBRA pays second. Now, if your spouse or children are on the plan, they're younger, it's still going to pay first for them, but not for you. And then I don't want to keep that COBRA coverage for me. I have A and B, but then I want to make sure that if I want a Medicare supplemental plan, I've taken action within 6 months of starting Medicare, because if I don't, now I'm going to miss this Medigap OEP, because this Medigap OEP, open enrollment period, tied to Medicare supplemental plans is only 6 months long, and that's based upon your B date. So once the B date has started, we have a 6-month window where in every state in the country, you can get any Medigap policy that you want, based upon your age, of course, and what's available in your area. And there's no underwriting involved. The insurance company must approve the application. They cannot charge you extra. They have to cover all your pre-existing conditions. It's wonderful. Even if you're terribly unhealthy, you can get that Medigap policy. But again, it's only 6 months of the B date. Now, listen, you don't have to wait till the B date starts to get a Medigap policy. Most people don't. They normally apply about 3 to 6 months in advance. When your B starts, your Medigap policy starts as well. And again, you've got all that set up with no underwriting at all because you use the Medigap OEP. But if I were to wait beyond 6 months, that OEP expires. So let's talk a quick example. Let's say that my Part B date is 3/1 of 2025, here in just a couple weeks, 3/1 of 2025. That 6 months would be counted this way: March, April, May, June, July, August. So if I wanted a Medigap policy anytime between March and August, I'm in my 6-month OEP and there's no underwriting at all. They cover my pre-existing conditions. They will approve my policy. But after September 1, I want to get a Medigap policy. Now I have to go through medical underwriting. We got to ask you 30 health questions, maybe 40 health questions. Check all your medications. And now the insurance company does not have to take you. They can say, no, we're going to deny the application. Now, New York, Connecticut, Vermont, different rules there. But everywhere else, you're not going to be able to get that Medigap policy if you miss the Medigap OEP. So that's what I'm saying. I think it's a terrible mistake when people are not aware of that. So don't make the mistake, especially if you have health problems. This could be your once-in-a-lifetime opportunity to get a Medigap policy. All right, so let's go back. Who has to go on Medicare at 65? Those no longer working, spouse no longer working, those that are covered by COBRA, those that are covered by TRICARE, retired military. Again, you have to enroll in A and B at 65. TRICARE pays second to Medicare. If you're with a small employer, 19 employees or less on the payroll, same thing happens. Medicare first payer, your group plan is second. If you don't enroll into Medicare and you're covered by a small employer and you have a large claim, you will quickly find out that insurance company is not going to pay first, it pays second. You have to enroll into Medicare, and if you don't, that's on you. You become the first payer. And then lastly, anyone that's covered by an Affordable Care Act plan, ACA plan, you went through the healthcare exchange to get that plan. Here's what happens. At 65, all the incentives of an ACA plan are gone at 65. Gone. That means you pay full premium, which is expensive. You'll get no tax subsidy for that. You'll get no cost sharing by the government. You'll pay the full deductible, the full max out of pocket. So folks, if you're on an ACA plan, there's no reason at all to keep that at 65. Medicare will always be your best option, even if you're high income and you have to pay a large IRMA. It's still better to go on Medicare at 65 and come off of the ACA plan. All right, here is my point. The first decision you got to make that's right is go on Medicare at the right time. So hopefully you concluded, well, Marvin, you left me out. Okay, who doesn't have to go on Medicare at 65? Those that are covered by an employer-provided plan of theirs or their spouses, and there's 20 employees or more on that plan. You don't have to do anything at all with Medicare. Don't have to do A, don't have to do B, nothing. And I promise you, as long as you have paid into the Medicare tax system for 40 quarters, we get 4 quarters a year, 10 years paid into the Medicare tax system, you'll never be penalized on Medicare A whenever you pick it up. A lot of people think, well, I got to take A. Even if I keep working, I don't take B, I got to take A. And if I don't take A, I'll be penalized. That is not true. The only people that ever pay a penalty for A are those that do not have 40 quarters of Medicare taxes or they can't get it from their spouse. And that's 1%, folks, of the population. 1%. 99% of you will have A free. So if you're still working, your spouse is still working, group plan of 20 or more, you don't have to do anything at all with Medicare. Why do I mention it? Because some of you are going to keep working and you have a health savings account, HSA, and you're contributing to that. The max this year, individuals, $4,300, families, $8,500, $1,000 catch up if you're over 55. So you can contribute pre-tax dollars into an HSA. But once you take Medicare A only, or B, or both, you can no longer put new money into your HSA. Now, what's there is yours, but you can't continue to fund that. And so if you're working and you have 20 or more at your employer and you have an HSA, don't do anything. Just say nothing, and you won't be penalized. And you can pick both A and B up when you get ready to retire. Now, listen, if you don't have an HSA available that you're contributing to, and you're going to keep working, your spouse is 20 or more employees on the payroll, then I would enroll into A only. Okay, that's a good choice. There's no cost to it for most people, and in that position, your group plan still pays first, but A will pay second. That's a hospital claim. And Medicare A will pay no deductibles. Medicare A pays no copays, but they will pay coinsurance. So if you had a hospital claim and you had some coinsurance, Medicare will coordinate with that group plan and help offset some of those expenses for you. So I am fine with A only as long as you don't have an HSA. And don't worry if you do have an HSA that you're going to be penalized because you're not. Okay, you just won't. You can pick it up at a later date. So decision number one, go on Medicare at the right time. Decision number two is then you have to decide after you get educated, do you want to use your Medicare benefits and stay in A and B and get a supplemental plan? Or do you want to stay in A and B but come underneath a private health insurance system called a Medicare Advantage plan? Those are called C plans. And so those are your two options, A and B with the supplemental plan to cover the gaps, or a Medicare Advantage plan. Okay, now listen, our company, we're a broker. We write all over the country. On average, we write about 2,500 policies a month. So we write everything. Okay, but I will tell you, my opinion, if you can afford the extra premium for Medicare supplemental plan, I believe that in the long run, especially if you have health problems, you're going to be happier with that decision. But again, Medicare supplemental plans have a premium. You're going to have to pay for those on a monthly basis. Some people don't want to do that. Some people don't have the money to do that. And if that's the case, then you get an Advantage plan. But if I'm going to compare these two systems as far as quality of coverage, those kinds of things, then I think Medicare supplemental plans always win out. Now, there are two disadvantages to supplemental plans. Number one, you got to pay a premium for them. But you get what you pay for. So when I pay a premium for a Medicare supplemental plan, what am I getting? I'm getting the opportunity to be able to go to any doctor that takes Medicare, because supplemental plans do not have networks. You can go to any provider, any hospital, any doctor, any surgeon. As long as they take Medicare, they will take your supplemental plan. If you do the other alternative, Advantage, you're not going to be able to do that. Probably at best is going to be maybe 50% of the doctors in your area are going to take your plan. That's the way it works. So you're going to be limited on your providers, because providers don't have to take Advantage plans. They do. Some will take maybe one or two. Some will take all. But the point is you have a limited pool of providers with your Advantage plan. Now, there still may be plenty of options and you're happy with that. Then that's all right. But just know that's the difference between SUPs and Advantage. SUPs, no networks. Advantage, always networks, either HMOs or PPOs. If I'm on an HMO, you can't go out of your network. PPO lets you go out. It's just expensive to do it. When I have a supplemental plan, I can go anywhere I want as long as I take Medicare. It's basically a nationwide plan. All right? And here's what I'm saying to you. When you go on Medicare at 65, you have this opportunity to get a supplemental plan if you can afford the premium, and that's the kind of coverage you want, and there's no underwriting involved. But if you take an Advantage plan and you stay on that Advantage plan, let's say for a year or 2 or 3 or 4, 5, 10 years or whatever, and you want to get off of the Advantage plan and go back into original A and B and get a supplemental plan, now in every state but New York, Connecticut, Vermont, you're going to have to medically qualify to make the switch from the Advantage over to the supplemental plan. A lot of people are not aware of that. Why is that? Because you missed your open enrollment period that I'm talking to you about tonight. You missed the Medigap policy, that opportunity, because you were on the Advantage instead. And so that to me is a huge mistake. Let me close out with this aspect of my time with you, and then we'll start taking questions. But when it comes to supplemental plans, another reason I like them is because we never have to deal with the pre-authorization. You see, when you have a Medicare Advantage, 70% of the time, the Advantage company has to approve that service, healthcare service, before you get it. MRIs, CAT scans, PET scans, any kind of a surgery, inpatient or outpatient, they're going to have to approve. Extended skilled nursing stays, they're going to have to approve. So they have the final say-so on the Advantage plan. And many times they will say yes, but sometimes they don't. They'll delay coverage. They'll say, no, we want you to try therapy for 9 months before we replace the knee. No, we want you to try this. We're going to pay for a rod in the hip instead of a full hip replacement. And you have to live with that because why? You gave that insurance company the final say-so with your healthcare services. If you have a supplemental plan, that can never happen. It is Medicare and your doctor set all the rules. The supplemental plan follows Medicare. Medicare pays, they have to pay. So you never have a pre-authorization imposed upon you by a supplemental company, right? So that's just the way it works. Now, also, I like the fact that supplemental plans are permanent. As long as you pay your premium, you can never lose the plan. I don't care how old you become. If you have health problems, they can't cancel you. If you have lots of claims, they can't cancel you. It is yours for life. You live in one area, you move away, you move to a different state, take it with you because it's permanent policy, totally portable. When you have an Advantage plan, 1 year at a time, they come and they go. Networks change. You don't take them with you. If you move, you get a new plan. And so my whole point is when you think about this decision, folks, don't just look at the monthly premium. Yes, monthly premium matters. We all got to live within our means. But there's more to a plan than just what you got to pay for it monthly. I'm concerned about what will it cost you if you have cancer or if you have a heart condition that's serious or diabetes or something like that. How's that insurance going to work for you? And so those two systems are different. Now, agents, and I'm done. Agents want you to buy Advantage plans usually because it's the most commission that we make is when someone sets up an Advantage plan. They buy an Advantage plan, we get paid about twice the commission that we would get on a Medicare supplemental plan. That's why agents push them. That's why companies want you to buy them. There's a lot of profit in that system. And so agents are incentivized by high commissions to push and to promote Advantage plans. Okay, now we write them, but we want to make sure people understand what they're getting. And so if you can afford a little extra, I think you have better coverage with that supplemental plan. I'm not saying Advantage plans are bad at all. I'm just saying to you there's a different quality of insurance. Now, a lot of people jump on the Advantage bandwagon because they're zero premium. Now, by the way, they're not zero out of pocket. They're usually max out of pocket anywhere from $3,000 to $10,000 a year, but they're zero premium monthly. So people jump on that bandwagon. Then secondly, they jump on the bandwagon because the insurance company offers some perks. They may throw in a little dental allowance or hearing aids or a gym membership, and they throw these perks in. And those perks are nice, but you have to decide, is it worth me to have networks, pre-authorizations, policies that could be canceled, all that? Is it worth that to have these other perks? And sometimes it is, and sometimes not. Okay, so we feel like, and other agents who share my view, feel like you have the right to hear about both. We're not going to push one or the other. We're just going to tell you the truth about both systems because you have to decide and live with that decision. All right, and so what do you have? You have 6 months of your B date to get a Medicare supplemental plan. Now listen, if you keep working past 67 and then enroll in B, that's when that 6-month window starts. So if you have A only, window hadn't started yet. But if you have A and B, window has started. You can apply 3 to 6 months in advance. Once the B starts, the Medicare supplemental plan starts, and we still have another 6 months after that to get a plan with no underwriting. After that, we're going to have to go through underwriting. All right, enough of that. I'm going to start taking your questions. I know I went a little longer. You probably wanted me to there, but I think it's important that people fully understand how the systems work, and we'd be delighted to help you. Okay, so all of you who have put your information in here, where you're from, thank you. We love to know that we're having an impact all over the country. We're grateful for the opportunity. Okay, so I'm going to skip through that. And remember, I'm all by myself tonight. So I'm going to start taking questions. And let me do this. Okay, the first one, David Mills. When you visit your doctor, does the doctor know what drugs are covered by your particular Part D plan? David, probably. Because the majority of medications that are available are covered by Part D plans. Not all of them for sure. And so I still think the burden of proof would be on you, but most doctors or a nurse or whatever would probably have a good indication. Now listen, when you enroll into a drug plan, you're going to be given a formulary. And a lot of times those are just going to be available online. And so you ought to be able to look at the formulary of your Part D plan to see if that medication is going to be covered. Now, I will tell you that the great majority of generics are definitely going to be covered. Now, if you have a very low cost plan, it could be that the brand name may not be covered if there's a generic alternative or a generic equivalent, okay? That may not be covered. But again, the burden of proof's on you. But to answer your question, I think most doctors are going to say, yeah, that's going to be covered. I doubt they're going to, guarantee that. So if you're concerned about it, go online, look at the formulary, and make sure that it's going to be covered. All right. So hopefully that helps. Let's keep going. Okay, let's look at this one here. Okay, Dave, considering the current administration, Medicare A, B, D, and G safe? Well, Dave, I personally think so. I do know that there has been some talk that if Dr. Oz gets appointed to be over Medicare, that he really favors Advantage plans. And so that could change. But I still think it's safe, and I'm going to tell you why. Because I think there's an element within our Congress that understands the importance to make sure that people have choices. If they force everybody on Advantage plans, now all of a sudden, now we have a private health insurance companies that are in control of Medicare. I think that is very unwise. Okay, now I'm not saying Advantage plans are bad, but that is something I think there's enough concern to going that direction where I don't think that's going to happen. I don't. I do know that insurance companies would love for that to happen. They are making billions and billions of dollars. I'm talking about Medicare Advantage companies. You look at the quarterly reports, I'm amazed at one just recently, $23 billion in one quarter. Now, not all of that was Medicare money, but a lot of it is. So these insurance companies would love for that to happen for sure. But I still think there'll be enough resistance for the Congress to say, no, we want people to have options. That we want them to be able to pick their own plans. We're not going to force that. They try to do that, through the whole ACA system, and that was very, very disruptive. So I just don't think it's going to go that way. I'm going to stop rambling on that. That's just my opinion. It's just too early to tell. Okay, so we're just going to have to wait and find out. Listen, I'm not quite 65. I'll be 65 here in a few months, and I'm going to get a supplemental plan for sure. And I think it'll be a lifetime policy. Okay, let's keep going. Oh boy. Someone's saying here, how do I get rid of StreamYard across screen? Boy, is that on my end or your end? I have no idea. Hopefully you're seeing what you need to see. I cannot answer your question. I am not techie. Everyone, smartest thing, that's this, hang on. You can do is work with these wonderful. That's nice of you, Peter. Thank you. We'd love to help anyone and everybody. So, Peter, thanks for the endorsement there. Okay, let's go to the next question. Here we go. This one. If I sign up for a supplemental plan in Minnesota when I turn 65 and then move to a different state a few years later, what are my options in the new state since they won't have the same plans as Minnesota? Okay, here's the way I think that's going to happen. So we write business in Minnesota. I've never had someone that has moved from Minnesota to another state, okay? But here's the way. I know Minnesota is a waiver state, Wisconsin is, Massachusetts is, so they're different. Everybody else has the same rules. But in Minnesota, even though the plan is structured differently, you're going to get the option to have a G equivalent or an N equivalent plan. And so that insurance company that writes you has to continue to offer that same benefit to you when you move out of state. They have to. They can't cancel it because you moved. And what will happen, it would just be you go to that state that outside of there, and it's not a waiver state, then I think you're going to be treated as though you still had a G plan or N plan because that's what you bought in Minnesota, an equivalent G or N. So I think you're going to be fine. And again, never had it happen, so that's just my opinion. I've been in the business 17 years and never experienced that, but I believe that's how it would be handled. All right, let's keep going. Here we go. Next one. Question. If waiting another year past full retirement to begin collecting Social Security, do I have to wait to my birthday or my birthday plus 10 months? My birthday would only be waiting 2 months past full. Okay, let's go back. So you said you're waiting another year past full retirement to begin collecting. So do I have to wait my birthday or my birthday plus 10? So you tell me you're going to wait for another year anyways. So when it comes to the 10 months, that means you're born in 1959. Anyone born in 1959 has a full retirement age of 66 and 10 months. And so it would be on the month. So at the 66th and 10th month, then you can start your benefits with no reduction in benefit. Now, you don't have to wait to that month to apply. You actually can apply for Social Security 3 to 4 months in advance of when you want to go effective. Your check then would be 1 month in arrears. So my birth would only be waiting 2 months past full retirement. So here's the thing. If you decide to go ahead and wait a full year, meaning now you've gone the full, now it's your 2 extra months, then what happened is that account grew. After we hit full retirement age, folks, our benefit grows by 0.67% a month. 0.67%. It's an 8% annual return. Divide that by 12, and it's 0.67%. So if you wait 2 more months, you just grew that full retirement age benefit, your primary insurance amount, by 0.67% times 2. So whatever, 1.34. So you can do that if you want. All right, hope that helps. Let's keep going. All right, this is CJ from Washington, turning 65 in November, but we're traveling and out of states during November, December, January. Should I apply for A, B, and D before November and pick supplemental plan in later? Okay, well, let's see. You're turning 65 in November. Okay, here's the way it works. So, I mean, you can do that if you would like. Okay, so I am assuming that you are not on Social Security. And so, number one, if you apply for Medicare A anytime within 6 months of your birthday, you're still going to have an A date of 11/1 of 2025. So the A date's settled. All right. So you're saying, can you do B? I wouldn't do that, and I'm going to tell you why I wouldn't do that. Because if something were to happen to you, and you didn't have Medicare B, you're going to be responsible for 100% of the expenses for anything that's going to be outpatient related, any doctor visit, anything happens. That's too much risk for me. I would go ahead and at least sign up for my A and my B. Now, as far as D goes, I would not put that off very long. In fact, the longest I'd put off D, if you do anything, you're eligible in November, so December, January, February. You can actually put that off and do an enrollment on a drug plan in February for a March 1 effective date, and you'll still not have any problems, okay? That's the last month of your IEP. And then the issue is you don't have any drug coverage, but if you're comfortable with that, that's all right. So A is going to be your birth month. B, just because of risk, I would go ahead and start that 11/1 as well. I just would get your drug plan. You can enroll in February. You have a March 1 date. Now, when it comes to supplemental plan N, you are fine to do that up to 6 months of your B date. So if I have a B date of November, which I would, we can go of all November, December, January, February, March, April. You can go up to all the way to April to enroll for an effective supplemental plan of 5/1 and not miss that open enrollment period window. You can do that. So if that's you're comfortable with that, go for it. All right, hope that helps. Let's keep going. Next question. I'm just going to go down the list, folks. Or should I defer applying A, B, D, and supplemental plan in until end of January when I'm back? Oh, wow. Okay. Well, if you want to assume the risk of that, that is certainly fine. I would not do that. I would at least get my A and B set up. I'm not sure where you are on income, but your B premium, if you're single below 106, married below 212,000, it's only $185. So for $185, I would not take that risk. Okay, here we go. Jennifer, can you get Plan D taken out of your Social Security benefit check? Do you guys help with that process? Yes, you can. The payment modes for Part D plans, all of them, are going to be come out of Social Security check, or you can do a direct bill, or some of them will actually allow you to do some kind of an auto payment, like a ACH EFT bank withdrawal. And so, yes, we do take care of all that for you. Happy to do it. So those are the 3 payment modes on all Part D plans. All right, Mark, here we go. Can you sign up 3 months before your birthday? I would advise you to do that before you leave. Oh, okay, very good. Mark, good advice. I agree totally. Okay, how is any of this going to make any difference with what is going on in Washington? Well, right now we really don't know. My view is I I don't think we're going to see huge disruption. Let me tell you what I hope, folks. I hope they get to the bottom of all the Medicare fraud that's going on. I'd be thrilled by that because there's a lot of fraud that goes on by, a lot of times it's international hackers outside the country doing the fraud, but you have a lot of providers. And the problem is right now, the reason so much fraud gets by is because there's not enough Medicare auditors. So I hope they get in there and start auditing and put some of these people in jail. That would be the greatest thing that could happen to Medicare. There's just billions and billions of dollars of fraud. That's sad. And also, there's a lot of abuse, in my opinion, by the Medicare Advantage companies because, they do different coding. There's different things they do to make people appear more sick than they are so they can get a higher reimbursement rate. That's wrong. And there's been a lot of lawsuits brought against them, but they lawyer up and lobby up, and then the government folds. And so I wish they'd stand up against those advantage companies and say, no, start following the rules. Now, listen, there's a lot of great actors in the Medicare Advantage field, but there's a lot of bad actors as well. And I'd love us to get them eliminated because they are problematic. All right, enough of that. Question. Do you have Kaiser Permanente Care in your list? Do they have good supplement plans? We do not, Omar. Kaiser is what we call a captive company. That you have to go directly to Kaiser to be able to have their coverage. And so, again, I can't tell you much about them. I can tell you that we have people who have Kaiser as a possibility that are now our clients. So we must have offered them something that they feel comfortable with or good about as equivalent to Kaiser. But we cannot write for them at all. Sorry. Next question. Here we go. The duck head is annoying. Oh, the duck head. Is that me moving? Whoa. Y'all, I tell you, it could be, and I'm really sorry. I can't change anything. Sorry it's annoying, but I can't do anything about it. I like ducks. Very good. I'm very happy with my original Medicare. I get to choose my own doctors and very little pushback about approvals. Yeah, Medicare had something like maybe a clinical trial study or something, but the supplemental plan can never give you pushback. If Medicare pays, they are going to follow. And I am sorry about the duck head, you all, but I don't know how to get rid of it. All right, will you address the threats to Medicare and Social Security as a result of the new administration? Okay, I've already been doing that, Valerie, and right now it's too early to tell. As far as Social Security threats, I don't think there's any. They're not. If anything, I hope they improve Social Security, and I think that's going to be a great possibility just because the trust fund needs some shoring up. And that's going to affect the next generation. I think they're going to push the full retirement age out to probably, maybe 72 or something or some older age. And then I think they're going to raise what we call the tax max. Right now, the maximum taxable income for Social Security is $176,100. So if anyone makes above that, then that income is not taxed for Social Security purposes. So I think they're going to have to raise that. So I think they'll actually probably improve Social Security. And the Medicare, we'll just have to wait and see what happens. Okay, I have an HMO POS plan that actually allows me to go out of network with higher copays. Is this another way of getting out of network benefits without getting a PPO? It is. It is. Now, what you have to know about this, those of you that are maybe not familiar with what he's talking about, when it comes to Advantage plans, they have HMOs and PPOs. HMO, you're required to stay in your network. On what he's talking about, HMO POS. POS stands for point of service, and they allow you to go out of the network, and it's right, costs you more to do that, but at least you can do that. So if you're in an area and you want an Advantage plan and you can't find a PPO that works, then an HMO POS would be better than a straight HMO, because straight HMO, you can't go out of the network. So the POS option gives you the chance to do that. You got to know what's going to cost you. Plus, sometimes we'll see point of service is not just anything you want. It's only on certain types of services outside the network where they'll allow you to do that. But you got to read the fine print on those Advantage plans to make sure. All right. Next question. I'm going to get TRICARE for life, but I'm not sure how to start it. Okay. Well, Chuck, right now you are on TRICARE. TRICARE will automatically go to TRICARE for life. There's nothing you have to do as far as that is concerned at all. It's going to happen. You will go on TRICARE for life. But what you have to do, Chuck, is you have to enroll into Medicare A and B to get TRICARE in the second payer position and Medicare A and B in the first payer position. Because once your 65th birth month hits, TRICARE goes second. And if you don't enroll, you're the first payer if you have any kind of a claim. I was going to try to look that number up for you. You can call them, and I've got the number right here. Let me do it. Give it to you real quickly. TRICARE. I thought I had it. Sorry. I do have it. TRICARE. Write this number down. TRICARE for Life is 866-773-0404. 866-773-0404. Eligibility, if that's what you're concerned about, is 800-538-9552. 800-538-9552. All right, let's keep going. Okay. Hey, Will, Facebook video isn't working. I am sorry for that. I do know that you can go back. This should be posted by our people, so you'd go back and watch that other 13 minutes. We have a whole tech team, and I do not know why that happened. I'm really sorry. Becca, if you haven't worked because of disabilities but have also been rejected for disability, can you still get Medicare when you turn 65? Well, as long as you have paid in 40 quarters, 10 years worth of taxes into the Medicare system, then you will be eligible for Medicare at 65. And so now, if you're not yet on any form of Social Security, you're going to have to self-enroll to make that happen. Now, Becca, if you don't have your own 40 quarters, if you're presently married to someone that has 40 quarters and they're at least 65, they don't have to be on Medicare, but they have to be eligible for Medicare, then you can draw your 40 quarters from an existing spouse. If you're no longer married, you're single, but were married before, as long as you're married 10 years, and you're now single, you can go back to the ex-spouse as long as that spouse is at least 65 and has their 40 quarters as well. Okay, so that's the way it works, Becca. So hopefully you worked long enough to get that, and so don't worry about the disability issue. Medicare will cover you, and don't miss that 6-month window. So if you've got some health problems, this could be your one and only opportunity to get a Medigap policy. So be sure to do that. Don't mess that up. Okay, Mark Farrell. Sign up for Medicare A and B. TRICARE is supposed to kick automatically, but only after A and B has been established. Still, verify with TRICARE. Okay, thank you. Mark, appreciate that advice. Let's keep going. Okay, can you talk about the trial period? If you give an example, can you use a date other than January 1? I sure can. Okay, so here's the way the trial right works. And what I'm going to do is I'm going to give you the federal trial right, because some states have some variants of this. But the federal trial right says this. If you are turning 65 and you have A and B set up, let's say it's this next month, and we have A and B of 3/1 of 2025, and we opt to enroll into an Advantage plan at 65. So that Advantage plan kicks in 3/1 2025, just like our A and B did. For the next 12 months, so from 3/1 2025 up until 2/28 of 2026, you're in a trial right period. That's full 12 months. And again, A and B started at 65, when we had an Advantage plan at 65. So anytime within a 12-month period, if you decide you don't want to be in the Advantage system and you'd like to return back to original Medicare A and B and apply for a supplemental plan, that supplemental company has to approve your application. Okay, you do definitely have that trial right to do that. And you can get that during that first 12 months. Okay, now, in some states, there's a little variance from that. It's very weedy. I'm not going to get into that. But as a general rule, that's the way it's going to work. So here's what happens. In some states, let's say that I do A only at 65, keep working because I'm covered. I'm working and my spouse is working, so I stay on an employer plan, and then retire 2 years later and start B. So A at 65, B at 67. And then in most states, if I enroll into an Advantage plan with a B date different than my A date, I don't have a trial right. Day one, if I want to get off my Advantage and go back to a supplemental plan and A and B, now I have to medically qualify. Okay, that would be the federal guideline. So that's the key to the trial right. A lot of people think they have it, and they don't. But if again you start at 65, you definitely have that 12 months. All right, let's keep going. Next question. I have the same question as Valerie. What effect will the new administration and DOGE have on regular Medicare? At this point in time, we have no idea whatsoever. I said earlier, I hope that DOGE gets involved in finding a lot of Medicare fraud. I hope that's what happened. I do not think supplemental plans are going away. Folks, they've been around since 1965 when Medicare began. Okay, they've been around a long, long time. I think there's enough element of people within the government that are going to make sure that the consumer has options. And I don't think we're going to see a one-payer system within Medicare. I just don't. But again, that's my opinion. We'll just have to wait and see. Here we go. Okay, can I change my Plan D now? I don't want to take medication on a daily and Aetna triple their monthly premium. Okay, Cheryl, maybe. It just depends on where you live. And so if you're our customer, I want you to call in and we can help you navigate through that, okay? Now, if you're not, and by the way, if you're not, you can do this, okay? I'm saying, by the way, you can do it on your own. For our customers, we would help them with this. But if you're not a client, what you can try, okay, is you can go to the Medicare.gov site, look at plans there, and if you find a plan that you want to enroll in, you can, if this is true now, if your state, wherever your state you're in, has what is called a state pharmaceutical assistance plan, state pharmaceutical assistance plan, then that gives you a special enrollment opportunity to be able to disenroll at this time of the year and select a different prescription drug plan, okay? State Pharmacy Assistant Program. So, because if you go online and you try to enroll in that, they're going to say, why are you trying to enroll now? Are you losing a group plan? Did you just lose Medicaid? In other words, they're going to have all these different options for you. And if you have the option and that says I'm losing, my state offers a state pharmaceutical assistance plan, then that could be an option for you to enroll into a different drug plan for this year. And so again, you'll have to go through that process to see if that's possible. And if they accept your application and approve it, you can switch. If not, you're going to have to stay where you are until later this year, October 15th to December 7th. Don't miss that window to enroll into a drug plan. All right? Okay, hope that helps. Let's keep going. Here we go. I just signed up for B and already had A. I will contact TRICARE. Thanks very much. Okay, good. That's wonderful. Call them and get things set up there. All right. Does a paper application for Medigap take longer to approve, and why? Well, it can, because with a paper application, we don't have automatic underwriting. So that is very possible. Now, I will tell you, some of the carriers are still taking 2 or 3 weeks. Now, when we were going through open enrollment, this October 15th, December 7th is a little bit longer, but paper apps can take longer because with those, we don't have an auto underwriting option. Sometimes when we do an application, we have immediate approval electronically based upon how you answer the questions and based upon your medications and the records they have available to them through the the Medical Information Bureau. Okay, so that would be one reason it would take longer. It's got to be submitted, and it's just a little bit of a longer process. Okay, so hopefully that helps. Okay, here we go. If I move to another state where Kaiser doesn't have service, can I switch to the traditional Medicare supplemental plan without qualifying? Connie, you would have the right to do that. Now, listen, if you are with Kaiser, and by the way, I don't even think Kaiser even does supplemental plans. But if they do offer supplemental plans, that supplemental plan still has to be covering you for life. They can't cancel because you move. But again, I don't think they have supplemental plans. So Kaiser is more like an Advantage type of a system. And so what happens if you move from there and you lose that Advantage plan, you move to another state, you'll have a window of opportunity to be able to get into a Medigap policy with no underwriting. That's called guaranteed issue, GI right, that you would have. And that window, I think, is like 60 days or something from when you move. So you should be able to do that. But again, if they offer a supplemental plan, that has to stick with you for life. Advantage would be canceled, but then you'd have the short window to get a Medigap wherever you move to. All right. Here we go. Okay, 65 and 11 months. I changed jobs around 4 months ago, and I just found out we have less than 19 employees. So did I mess up by not enrolling in Medicare B? I already have A. Okay, no, you have not. Okay, but here's what I want you to do. You need, if it were me, I would encourage you to get enrolled into Medicare B now. And the paperwork, and seriously, if you want us to help you with this, help you get all your plans set up, my agents can do this. And I know we have this number scrolling across the bottom. You can call in and an agent will walk you through this. And so even though the employer is small, what happens is when you come into Medicare in your scenario, you're 65, 11 months, you're coming in under what we call an SEP, a special enrollment period. So as long as you've had employer coverage back to age 65, you qualify for an SEP. Now, what's the blessing in your part is that on that SEP paperwork, which is called the L564, it does not ask for the size of the company, which is wonderful in your regard. Now, your risk has been if you're covered by a small employer, that insurance company only pays second to Medicare. You're still going to be able to come in, and I would do it ASAP. Again, call us and let us go through this. So let me repeat it. So I'm saying you're not hurting, but you want to apply for B, and no one's going to ask you what size of a company you work for. They won't. You do not have to disclose that because they don't ask you. So you just have your employer fill out the L564. And by the way, if you work with us, we will initiate that properly, get it to you, send it to an email, then you'll get it to your HR people, and then you'll take that document and one more document called the CMS 40B, and with the L564 from the employer, the 40B from you, two of those documents, you'll get to the local Social Security office, and then you can request a start date on Medicare B for 3/1 of 2025. You can still do it. It's still plenty of time this month to pull that off. Again, call us. We'll help you, and there's no cost at all for our services. We'll take care of all that for you. Okay. Now your HR people got to fill it out, but we'll make sure everything is going to be done properly. So we'd be happy to help you with that service. Just call in. The switchboard is open until 7 Central Time. So what time is it? 5:45. So we're still open here. I got agents, that a live agent can take your call. All right, here we go. Deniability. What if Medicare denies, does the supplemental also deny? Is that also true for Advantage plans? Okay. Well, first off, when it comes to Advantage, Medicare is not a part of that. The private health company is a part of everything. They oversee, they administrate, they deny, all that. So again, with Advantage, Medicare is not involved, folks. When you have an Advantage plan, what happens is Medicare actually gives a flat reimbursement fee to the Advantage company on a monthly basis. I think it's about $1,200 a month. And so now they're responsible for you, and you fall underneath their rules of umbrella. So that private health insurance company can sure deny you, but Medicare is not. Now, let's answer the other part. What if Medicare denies, does the supplemental also deny? And the answer to that is yes. If Medicare doesn't cover, supplemental plan will not cover either. Supplemental plans are filling in the financial gaps of those things that Medicare covered but didn't cover at 100%. That's the Medigap policy. Now, one exception. If you had something happen to you outside of the U.S. and you had a G plan or an N plan, a couple other plans, what happens is you are given $50,000 worth of foreign travel emergency benefit. $50,000, that's a lifetime benefit attached to 6 of the 10 Medicare supplemental plans. So Medicare doesn't pay anything outside the U.S. or U.S. territories, but your supplemental plan, one of the 6, would up to $50,000 lifetime benefit. So that'd be the exception. Otherwise, always look at your Medigap policy as that they're following Medicare. They make no coverage decisions at all. Medicare covers, they have to cover. Medicare doesn't, they won't, except for foreign travel. Okay, keep going. All right, sorry. Okay, the StreamYard is very distracting on the bottom of your screen. You all, I am really sorry. I do not know how to change that. I just don't. So if you want to tell me, that'd be great. Very annoying. I am really, really sorry about that. I don't know if I can open it to a full screen or something. I just don't know. I'm afraid to push the wrong button and I lose you all. So you're going to have to live with that. I'm really sorry. I am totally not competent for anything techie. Okay, here we go. I'm born on January 1st, 1960. What is the last month for me to enroll in Medicare? Okay, well, January 1st, 1960, you would treat it as though you were born in December of 1959, because when you're born on the first day, your effective month is 1 month prior, okay? And so if we had a birth date then of 12 of 1959, so they're going to treat it as though it was 12 of 24. So you're asking me what's the last month for you to enroll in Medicare. And I'm assuming that you're no longer working. So I'm assuming you're saying you need to start at 65 last month. So that'd be 12, 1, 2, 3. So you can enroll as late as March 31st for an effective date of 4/1. Okay, so that's the last you can do it. Now, here's what's going to happen. You enroll in March. They'll backdate your A date to your birth, to 12/1 of 2024, and your B date would automatically be 4/1 of 2025. That's the way that would happen. So that's the answer to your question. March is the last month after that. You've made a huge mistake, so don't miss it. Okay, let's keep going. Okay, get N over G. You save more in the long run. I had G, it was great, but I saved more on the end. You will get raises until you die. MDs prefer NG over any Advantage plan. That's for sure. There's too much paperwork with Advantage. Okay. Now, by the way, I agree with RG. I think an N plan is still fine, especially in some states. There's substantial difference between the G and the N premiums, so that's fine. I would tell you that G is still the popular plan in the country. I think right now about 70%, 65 to 70% of all people get G. 35% get N. And in some states, there's sometimes a $100 difference. Other states, there's $30 difference. And so if that $30 a month difference is substantial for you, then you get it in. But if you're saying that $30 is not going to make or break me, I just soon have the most comprehensive plan, that's going to be the G plan. Now, there's not a whole lot of risk with the N plan, I can assure you that, because the only thing N doesn't cover, that G does cover, would be excess charges. And that's when a doctor adds 15% to the bill. It is very rare that that happens. Less than 5% of doctors even do that, okay? So, but if it did happen and you had an N plan, you would pay the excess. The G would cover it for you. Plus, N has a couple copays. They're very reasonable, very small. See, any kind of a provider, you pay $20 copay up to go to the emergency room, $50. So I'm not saying RG's advice is bad, but again, some states it really matters, some states not as significant. All right, I'm going to keep going. Next question. Okay, they can't cancel you, but they can raise their rates continually. Okay, and that is true. Supplemental plans rates are subject to being raised, and that's a fact. And your homeowner's insurance goes up, and your automobile insurance usually goes up as well. And again, we can reshop those as long as you can medically qualify. Go with a company that's proven to be very rate stable. That's always our goal. But I would say this, yes, they can raise, but look at the max out of pockets on Advantage plans this year. They went up substantially. So everything is going to go up because of medical inflation. So Kenneth, you are right. But again, if someone cannot afford that, then they ought to be able to get an Advantage plan. But if they can afford some slight raises, then something can still work for people. Okay, here we go. Okay, Jack, I can't help you. Get to be established, yes, and then check out the TRICARE free. Yeah, well, yeah, and we can't help with TRICARE because that's going to be the government. But you can actually go online and apply for Medicare B with a myssa.gov account. Okay. All right, I will sign up for A and B on retirement this year. My employer provides supplemental insurance to retirees. Can I take it instead of Medigap? What should I consider? Well, the majority of employers that offer some type of coverage in retirement are usually offering Medicare Advantage plans. Okay, I have seen on a rare occasion where it's truly a supplemental plan. If it is, and it's a G or N plan, I think that's awesome. Find out what the premium is. And so I have seen that, but the majority of retiree plans are Advantage plans, which is a whole different system. Then you have to decide, are you happy with that Advantage plan? But again, if it's a supplemental plan, it's not going to be supplemental and private. It's probably going to be secondary to Medicare. So find out what it costs, make a comparison to the normal market, and if it makes sense, then stay with the retiree plan. No problem whatsoever. But I still would do a comparison to make sure you're getting the best deal, best coverage. Okay. Does annual deductible mean only January, December from when plans started mid-year? If annual, should I choose to retire? Okay, just depends. Annual deductible is true on a B deductible. That is a calendar year deductible. It is true on drug plans that it is a 12-month calendar deductible as well. Now, on the A of Medicare, it's not an annual deductible. It's called a benefit period deductible. But if you get a supplemental plan, G or N, it's going to be covered anyway, so it's really a non-issue. So yes, sometimes deductible is annual, meaning calendar year. That's the norm, not 12 months. So it just really depends on what part of Medicare you're talking about. But as a general rule, yes. So, I mean, to me, let's talk about this. So you said, should I choose to retire in January? The deductibles in Medicare B this year is only $257. So to me, I would make a retirement decision based upon the B deductible. If you get a supplemental plan, the A deductible is a non-issue anyways. So when it comes to medications, then that could be an issue. It's $590 this year, so that's a little bit higher. If you take cheap meds, you're not going to hit your deductible anyway. So there's a lot more to that. But I wouldn't make my retirement decision just based upon a deductible in Medicare. I would not. Maybe if you're thinking either November, December, January, then maybe. But if I want to retire right now, I certainly wouldn't wait around until January because of deductibles, because they're not that high. Okay, Jackie, glad to have you. All right. Okay, Dave, Nate, which deductible? Well, it depends. I got to know which deductible you're talking about. Okay, is any retirement insurance that is not supplemental GN or F considered an advantage plan? I would say this. The majority of them, yes. I've been in this business 17 years, so in the old days, we would see some secondary plans offered by companies that were called indemnity plans. AT&T retirees had this, and some of them still may. So the way to look at that is if it's not FG or N, or it's not Advantage, then it's just secondary to Medicare. And then it's going to have its own rules. It could fill in all the gaps of Medicare, or you may still have some out-of-pocket cost-sharing expense. So it's going to vary. So we have secondary coverage, we have supplemental plans, and we have Advantage plans. All right, I turned 65 in January, just last month. Good, took A. As I'm still working, have insurance through them. In your February, our company's insurance raised substantially. Can I decide now to take B and take a supplemental plan now? And yes, you can. So let's talk about how to do that. Kelly, so if you do that, the way you're going to do it is very simple. And let us help you with this, please. It didn't cost us to help you. We're totally free. And the price is all the same. And let me just kind of put a plug in for that, folks. Do you realize that insurance companies set premiums? Brokers don't, agents don't, insurance companies do. So whether you went with ABC Insurance Company direct, or the ABC Insurance Company through us, the price to you is always the same. The premium is established by the insurance company. What you get with a broker, at least someone that's going to be legit and helpful, is service. The big insurance companies today, I guarantee you call their customer service team, 99% of the time you're going to be in India, Philippines, or China. You're not going to get somebody in America. You work with a broker, us, or somebody who's reputable, you call in and we help you. And it doesn't cost you anything. We never bill our clients. We are paid by the insurance companies. That's just the way it works. So Kelly, call us. We'd help. But here's the way we would do that. There's a form called the CMS 40B that you need to fill out. It's very simple. Your name, your address, social security number, you sign it. And there's a little comment section. And what you're going to do is you're going to put in there, please start my Medicare Part B effective 3/1 of 2025. Okay, you're still in your IEP. That's why you can do that. You don't have to have any verification from your employer. You're still in IEP. So you turn 65 in January, so that's February, March, April. So you can do this all the way up until April for a May 1 start date. But what I would do it ASAP. Get that 40B in this month. You drop it off at the local Social Security office or mail it in or fax it in. If you mail or fax, I do both. Or drop it off. That's really the best way if you can. And then the 40B has your information. You request your effective date to begin 3/1 or 4/1, whenever you want to start. And then that'll take care of this problem. Drop the company plan if it's lousy and expensive. All right, let's keep going. Give us a call. Really, Kelly, we'll help you. Okay, I didn't know they had TRICARE for Life supplemental. Well, again, it wouldn't be supplemental. TRICARE for Life is secondary to Medicare. It's full coverage, so it's kind of like a supplemental plan F, but it's not called that. All right, it is called secondary to Medicare. And I'm not trying to be overly technical, but supplemental plans, there's one of 10 options. So TRICARE is not one of them. Okay, Dave Nay, either you sign up for a supplemental plan or you don't. There's no consideration. Either you sign up for an Advantage plan or you don't. Okay. Here we go. Turning 65 in May, receive Medicare card. Can I return card now and refuse B and reapply in July for Part B? Trying to save a couple of months premium. Okay, well, here's the way it works. So let me read your question. Turning 65 in May, you receive your Medicare card. You're obviously on Social Security, so it starts May. So that would be May, June, July, August. Okay, so you can do that. Okay, but here's the thing, Disney, Pop. if you decline B, send the card back in and decline B, now all you have is A only. So if you don't have a group plan available to you, you're at a whole lot of risk for $185 a month. So I would not do that. So you're saying reapply in July for Part B. So your birthday's May, so that would be June, July. If you applied in July, you'd have a Plan B of August. So yes, you can do that, save a little bit of money, but if you had any kind of a health issue, only thing you have is A. So if you had a surgeon, you had any kind of doc stuff, MRIs, CAT scans, you are liable for all of those expenses. I wouldn't want to do that. If you're comfortable rolling the dice for that, yes, that'll work. But I would advise against it for sure. Too much risk for $185 for a couple months. For me. I'm in the business, so I've seen all kinds of crazy things happen. That's all. Okay, here we go. This says RP United Healthcare offers free gym membership at many different locations. That's true. United Healthcare ARP actually has two types of policies. They have one United Healthcare and one we call UHICA, United Health Insurance Company of America. Both United Healthcare companies, but the straight ARP United Healthcare plan does offer a gym membership. As long as your gym is within network, it's called Renew Active. Renew Active is not Silver Sneakers. It's good, but it's not Silver Sneakers. If you have a UHICA policy, it does not come with that benefit. And that UHICA policies have a little bit of a lower premium, but no gym membership. So she is right. Okay, here we go. All the dental with Advantage plan isn't much. I know because I'm a dentist. I see what dental plans pay. And Doc, you're exactly right. Advantage plans, and by the way, they're worse this year than were last year. Last year they were decent, but this year a lot of them have gone just to preventive only. They won't even cover anything, comprehensive or extraction filling stuff. It's preventive only. So I tell people on Advantage, be sure to read the fine print. Some of them have decent. Some of them you have to go to network providers. Some of them you have only preventive. Others of them you have to, you pay the bill and then you get reimbursed. So there's a lot of variables with Advantage dental. I don't call it a dental plan. I actually call it a dental allowance. Real dental plans are going to be anywhere from $2,500 to $3,000 annual benefit up. And so that's a true dental plan. So Doc, thanks for the help, advice. I agree. Here we go. I have Medicare. United Healthcare HMOPS is this good. I pay for premium, which is fine. Okay. Well, Vicki, I've never seen anyone have to pay a premium for an HMO POS. Is probably very small, and if that is best for your budget, and if your providers are in the network, then I would say that's good. I've already said earlier, I'm more of a fan of Advantage plans when people can afford the extra premium, just because I know they provide more options for docs, no pre-authorizations, permanent plans. So there's a lot of benefits, advantages to me for a supplemental plan. But if a person can't afford it, they shouldn't try to. Then get an Advantage plan. So your POS could be fine. Healthcare is just as good as any other companies when it comes to Advantage plans. Okay. All right. Do supplemental plans have dental coverage? And the answer is no. Now there are some times when a supplemental company may offer a dental plan as well. A few of the large carriers do that. United Healthcare does that, and it does that. But those are separate, we call standalone or ancillary dental plans, but it's not part of the supplemental plan. Again, the company may write those, but it will be separate for sure. They may give you a better price too on that dental plan if you go with them, but it still is separate. Okay. All righty. All right, Mark, thanks for the advice to Chuck. Appreciate it, Sarah. Let's keep going. Okay, how do I know if it's best to keep my group insurance through my company or cancel and go strictly on Medicare? Very easy, Terry. If you're taking notes, here's what you want to do. You need to do a comparison. So what you want to do is, number one, what's it cost you to be on the group plan? What's it cost out of your pocket? As a general rule, if you have a good plan, low deductible or reasonable deductible, and it's costing you $200 a month or less, good plan, low deductible, then I'd probably stay on the group. If you're paying $250, $300 or more for a plan that has, $1,500, $2,000 deductible up, max out of pocket of $5,000 or whatever, that's not very good. Medicare would probably make more sense. Okay, so my point is compare. What's your premium? What's your deductible? Do you ever meet it? What's your max out of pocket if you had cancer? How are your medications covered? And if you call in, Terry, we will do that comparison with you and for you. We'll lay those plans side by side, and our agents will be honest. If it's a good plan, we'll tell you so. We would say stay on it. If not, we'll tell you why Medicare may be a better option for you. Now, keep this in mind. If you have other family members on that plan, well, that's got to come into the equation as well, because do they have insurance options? Spouses that are on the plan, younger children below up to 26 on the plan. So again, there's a lot of variables that go into that, but again, lay them side by side and make the comparison. If you want help, happy to do that. Just call in and talk to one of our agents. Okay, here we go. Some of the plans have no dental. That's correct. They don't. Or vision. That's correct. You can get a vision add-on if you want to, but I will tell you, it's fine. Medicare covers you so well on vision anyways. Original Medicare covers everything except no eyewear or exams for eyewear. That's it. Everything else is covered: glaucoma, cataracts, macular degeneration, all that stuff covered by Medicare quite well. All righty, here we go. Do you write for Transamerica Insurance? No. Used to. Used to write a lot of business for Transamerica. In fact, I was their number 2 agent in the whole country. Okay, number 2. One guy beat me out in production with them, so I've written a lot of business. I loved them, but they went direct. So it's a direct-to-consumer option. I would tell you that, I still see their premiums, and they are not very attractive in most areas. Okay, not a lot of people taking them, so you're going to have a smaller block of business, which means rate stability may not be quite as good with other carriers. I'm not saying they're a bad company, because they're not. They're a great company, but they changed the way they did business right around COVID, and they just, no brokers, no agents, it's just all direct with them. Okay, but we can't write for them. Used to all the time. Here we go. Wilbur, FGN, I have no dental. Advantage plans of dental, but it is so small and disappointing to most patients, and that's true. So if you want dental, get an ancillary dental plan, or talk to your dentist. Sometimes dentists have plans of their own that can be very attractive. And a lot of people that have healthy teeth just self-pay. Again, about half our clients get dental plans, half don't. Here we go. Okay, 65 in June, still working, larger company, but not sure how much longer I want to work. Should I sign up for A and B, but which gap plan is best year in? Well, listen, Jackie, I wouldn't sign up for B until you know you're going to retire. If you want to take A, as long as you don't have a health savings account you're contributing to, that's all I would do. And then you can pick up B when you know for sure you're going to retire. So to me, it's a waste of money, because if you take A and B and you're with a large employer, the A and B is going to pay second, and your employer is still going to pay first. So why pay a premium for Part B to have Medicare in the second payer position? You can very quickly pick up B. If you told me right now, I want my B to start 3/1, we can make it happen. Well, of course, not you yet, because your birthday's in June, but you see the point. We can add B very quickly. I'm dealing with a guy right now, works for a hospital. A lot of instability at the hospital, is concerned about what's going to happen, and he's kind of in limbo. Doesn't know if he's going to lose his job or not. And he may need to start March 1, and we got all the paperwork ready to go. But we haven't submitted it yet because he's not sure. So again, we can make those kind of things happen very, very quickly. So don't rush out and get A and B. If you don't have an HSA, yes, get A. Get A only. And you can pick up B very, very easily. All right, let's keep going. Okay, what about those cards with free money to supplement Social Security? They asked to answer a couple of questions, get a card with free money and do not have to pay it back. Okay, yeah, well, Martha, those are probably Medicare Advantage plans that you're referring to. And again, there are some plans that offer some money. Now, most of those, now I don't want to say all, because there's like 4,000 Advantage plans in the market this year, but most of those have those cards and cash available for people that also qualify for Medicaid. So if you qualify for Medicare and Medicaid, we call that a dual special needs plan, and that's usually when you see those kinds of benefits. As a general rule, that's not going to be available on your traditional Advantage plans, usually dual SNPs, Medicare and Medicaid. All right. Okay, so who are you? Okay. Here we go. Depending on the county you live, Medigap can be very pricey. Well, if you find it to be pricey, I would definitely look at an in plan. And then if that doesn't work, then just find the very best Advantage plan you can, and we'd be happy to help you do that. Dr. Oz is old news. Kenny was just confirmed to head HHS. Yeah. Yeah. I think Dr. Oz is going to be over Medicare, though. It was my understanding. Yeah, I saw Kennedy did get confirmed today. Here we go. My plan is to work until 70 with 100 employee employment. HSA, I only need A from through 70. Okay. Well, here's the thing. If I were you, Mark, if you have not enrolled in A yet, don't. If you're going to work till age 70, what I would do is this. I would enroll into, let me back up and say this. You're going to work to 70. About 3 months before you turn 70, I would enroll into Medicare. That's when I would do it, 3 months before. And then from that date, 3 months before you turn 70, you back up the clock 6 months. And that 6 month from your enrollment date will be your A date. And that's the date from there forward you should no longer put money into your HSA. You can max out up till then. So I don't know why you're talking about 67 and a half. If you are not going to take Social Security and you're going to put all this off until age 70, then I would not take A until the very last minute. And again, 3 months before you retire, they backdate the 6 months A date, and that month there, you're done with your HSA. Hopefully you understand that. So way to go. Okay, am I understanding correctly? I have 6 months after turning 65 to purchase Medigap with no underwriting. That is true. I've already signed up for Medicare AB by age 65. That is correct. Yeah, you have a 6 month window. Now, listen, when you count those 6 months, Sandra, you've got to count your birth month. So let's do it again. Let's say my 6 month, let's say it was January. 6 months would start January, February, March, April, May, June. Have to have it in submitted by June for a July 1 start date. So you're within that 6 month window, but remember to count your birth month as one of the 6. And then that very last month, you need to be enrolling for your supplemental plan to go effective the next month. And there's no underwriting at all during that time. So you are correct. Here we go. Okay, you're an agent yourself. Okay. Those free money to entice unsuspecting to go to Advantage. Yeah. Yeah, I think Advantage companies are great at marketing. That's for sure. So, folks, listen, we've been around long enough to know if it's too good to be true, it usually is. Not true. Okay. Yeah, and again, I don't know who this person is that's claiming to be an agent, but I don't know them, so I'm going to answer your question. They're not affiliated with us at all. I'm not saying that he's not knowledgeable, but doesn't work for us. Here we go. Is there a dental plan you recommend for those on a supplemental plan? Well, it just depends. Number one, find out what your dentist likes and takes. That's where I'd begin. If you don't want to change dentist, then I would start there. Find out if there's a preferred plan they have, and there'd probably be several. Then I would be looking at several of those options and make a comparison to see what the annual benefit is, to see what the monthly premium is, to see what the rules are. When do they cover you? When do they not? So you want to really dig deep into that. And for our clients, we'll help you actually do that. Happy to. But I would start with your dentist. If you don't have a dentist, then you can, look at the plans themselves and then find a dentist that takes it. But I wouldn't enroll into a plan that the dentist didn't take because that's a pain. Okay, as a veteran, 100% disability rating, how should I handle Part B? Okay, here's the way it works. What I think I hear you saying is you're going to the VA for all of your health care, and you're happy with that. So if that's the case, then you can get by with just A only. But if you don't take B at 65 or when you retire, then down the road, if you want to pick up B, you can only add it the first quarter of the year, and for every year you went without Medicare Part B, you're going to have a 10% penalty for life. Okay, so for every 12 months we go without B when we should have had it, then you're going to be penalized. So that's what you're going to have to decide. Is foregoing the $185 a month worth it to you to not have B? And some veterans tell me, yeah, I'm happy with the VA, I'm just going to stay with them, then do A only. Just know there's some consequences for that. Doesn't mean it's going to be like the worst decision you made, but if you want to add B at a later date, you can only do it the first quarter of the year, and there's a penalty, 10% for every 12 months for life. Okay, so that's the consequences of that. You'll have to decide. Okay. Okay, I have AirMed, which covers us if they have to fly us to a hospital, but do I need to keep it if we have A, B, and G? All right, so here's the way it works. Medicare B will cover air ambulance and ground ambulance. And so you do have coverage. If it's medically necessary to transport you by, air ambulance, helicopter, whatever, then Medicare will cover that. And so I would not hesitate. Now, if you want the Air Med because of other benefits or whatever, then if it's inexpensive, I'd probably keep it. But for those that don't have Air Med, they still have coverage for air ambulance transportation. Okay, I just know the rules. The rules are it had to be medically necessary to do that. It was basically life-saving kind of a situation, which it almost always is. Okay, but they do have a couple criteria. I've never had a client yet declined on that. Okay, and I know they're used a lot. I mean, I just read something the other day. I think it's like 1,500 AirMed cases a day around the country. It's huge. So okay, I hope that helps. I'm gonna keep going. All right, does your company promote attain date or community rate plans or the issue date plans? Dennis, our company doesn't promote any of those because we don't decide that. Primarily, the insurance commissioners of the state are going to decide what insurance companies are going to write in their state. Now, it is true that some insurance commissioners will allow any of the above, and it's also true that some insurance commissioners say, no, you have to write community rated. I think there's 8 states that do that. Or you have to write issue age policy. I think there's 4 or 5 states that do that. But the majority of them leave it up to the insurance carrier. When it's left up to the insurance carrier, I can assure you it's going to be attained age, always. Okay. Now, there are some carriers that may say for marketing purposes, we're only going to write issue age, and we believe that's the best because your premiums are going to be more stable. And I am telling you that absolutely is not true. The stability of the rates have nothing to do with whether it's community, attained, or issue age. I promise you it doesn't. It doesn't. They all go up because of group increases. Community and issue age, that's the only way they can go up. Attained age starts lower, goes up a little bit as you attain another age, but they all go up. So this business of issue age for sure is going to be more stable. That is not true because it's issue age. It may be true because of that carrier and they have a large block and there's other things that contribute to the stability of the rate. But one of the 3 is not going to be more stable than another. I promise you it does not work that way. Now, agents that want to promote that are promoting a certain product. That's all they're doing. Now, again, if you want to get that, it's fine to do that. But we don't promote anything. What we're going to do is wherever you live, we're going to look at what's available. And usually the state, if it's an attained age state, that's all that's going to be available. If we have attained age versus issue, let's look at the initial premium. Let's also look at the stability of that carrier before we make the decision. So I don't make it based upon one of the 3 ratings. I wouldn't do that. Okay, I'm going to keep going. Okay. Yeah, this agent that keeps commenting, man, I just would not do that, okay? Yeah, this is our company. We want to help people. I'm glad you want to help people as well, but help them on your own platform. Let's go. If you sign up for Kaiser Advantage and move to another state, do you have to keep the Advantage model, or can I switch to something to plan in the new state? Okay, I addressed this earlier, but I believe that, I know. When you leave Kaiser in California, let's say you move to wherever, Arizona, you would be in a period of time, which I think is 60 days, where you would be eligible to get a supplemental plan with no underwriting in your new state. It's called a guaranteed issue right. It's not forever, it's for just a couple months. And depending upon when you started Medicare will determine what plan you get. So if you started Medicare before 1/1/2020, your guaranteed issue would typically be an F plan. If you started Medicare after 1/1/2020, guaranteed issue would probably be a G plan. So that's the way it works. All right, question. I just turned 65, great health. I take 6 meds, virtually all preventive. Okay, I have 0 extra cash month. I enrolled in Humana Advantage plan that covers all my meds 100%. Okay, and so what's the question here? Is it coming? So, Okay, well, here's the thing. If you have zero extra cash, I think enrolling into an Advantage plan is a wonderful move. And I think Humana is a fine company. Humana, Aetna, Cigna, United Healthcare, all those companies, Anthem, Blue Cross Blue Shield, those companies all I think are very similar when it comes to their Advantage plans. What matters is, are you comfortable with the network? Are your doctors covered? And your meds are obviously covered very well. So yeah, I think you're doing great. I would stick right in there if you're happy with it, for sure. Okay, here we go. Born July 30th, when is due date for G plan? Okay, if you're born July 30th and you're no longer working, no spouse is not working, that means your effective date on your Medicare will be July 1, A and B, July 1 of 2025. And so you can apply 3 to 6 months before July 1 so that your plan goes effective July 1 along with A and B. Or on the supplemental G plan, you have a full 6 months after your B date. So that would be July, August, September, October, November, December. So you can apply anytime from July 1 all the way through December 31. And when you apply, you're still in your open enrollment period, and the policy would start the next month. That's the way it works. Okay. Here we go. Turn 65 in July. Plan a supplemental plan along with Med G. Presently, when is it due? Okay, I think I just answered that question for somebody else with the July birth date. All right, not a bad route. The cursed honest truth. Okay. Okay, when are your live shows? Okay, I have one every Thursday at this time, 5 o'clock Central. I also do a Medicare Monday at 5 o'clock Central Time. That's through our Facebook group. And then as far as me speaking live, those are in Kansas City. That's where our home office is. And those are next week, actually. I do them about every 6 to 8 weeks in Kansas City, where our home office is. But, you know, we do business all over the country, so most people are going to our website or YouTube channel and watching things, virtually. Okay, this channel is great. This guy's very knowledgeable. Appreciate your encouragement. Okay, I made several referrals to Medicare school. All were eligible. I confirmed. Okay, good. That sounds great. For our clients, we have a referral program. And as long as they're eligible, you get paid $100 referral fee. It's legal for us to do that, and we do it. Happy to help. Okay, here we go. If your birthday is in March 2025, you can wait until June 2025 to sign up for A, B, G if you want a G. If your birthday is in March, you can wait until June, March, April, May, June. That's true. You can do that. But remember, if you wait and you have no insurance, you're liable for anything that's going to happen. But that is true. That's true. Your A date's still going to be March 1, but your B date can be put off till June. But you'd have to submit that application in May to make that happen. All right, so that is true. Okay, here we go. Sorry about that. Yeah, Cindy, you can call in our customer service team too. Make sure that you got your referral fees. Okay, here we go. Okay, is this a huge mistake? No. If your budget is very tight, don't worry about it. I would not. If my budget was real tight, live within your means and just make sure you find the very best Advantage plan that's working for you for networks. And out-of-pocket exposure. Yeah, I think it's fine. Why are some plans cheaper in some states than others? Well, here's one reason why, kind of referencing that question we had earlier. Remember, we had the 3 different types of ratings: community, issue, attained. And so what happens, the majority of states are attained age, which always has a lower initial premium. Community rating is higher. Why? Because the 85-year-old pays the same thing as the 65-year-old. But some states require that. And so that's why you'll see a difference. Oftentimes is because of the rating of the carrier. The stability of the rates has nothing to do with that, but the rating they can't have for sure. That's why they're cheaper. And really, that's the only reason. Okay. And also, there are some states that there are less claim history, meaning even where I am, I actually live in Missouri. Our office is in Kansas. And Kansas rates are less expensive than Missouri because there's different insurance laws in Missouri than Kansas. And so that sometimes has to be baked into the premium. Plus, the county where our office is Johnson County, Kansas. It's one of the healthiest counties in the state of Kansas. So the rates are actually a little bit lower here than other places. So there's a lot that really goes into that. Okay, here we go. I believe you get 3 months after your birthday to get a B, if you're trying to go as long as you can without having a premium due. And that is true. That's absolutely true. You can. Yeah, 3 months after. No problem. Let's keep going. Okay, husband turned 65 July. Is July considered a month to count and 6 months to apply? Yes. Yeah, so let's talk about this. So there's 2 different periods here, you all. If I'm enrolling into Medicare, the window is 7 months. Enrolling into Medicare to get A and B. So if birthday is July, that's the effective month, you back it up. Your 7-month window is June, May, April. So April, May, June are the first 3 months. July you can enroll, August, September, October. So that's your 7-month window to enroll into Medicare. The 6-month window has to do with your Medigap policy. So that would actually start July 1 all the way for the next 6 months where there's no underwriting. The majority of people don't wait to apply when they turn 65. They're actually applying for a Medicare supplemental plan 3 to 6 months in advance, like they would be applying for their Medicare A and B 3 months in advance. Okay, but officially the 6-month window I keep referring to, where there's no underwriting, the clock starts ticking on your birth month. That's the 6 months. That's different from the coming into Medicare. That's 7-month window, 3 months before you turn 65. The month you turn 65, 3 months after. Again, that's getting A and B. Supplemental plans are tied to the B date. All right, let's keep going. Okay, I have my Advantage premium covered by Medicaid. Okay, and I get dental with it. Should I switch to Medigap? How could I get dental then? No, I would not do that. If you qualify for Medicaid, I would stay right where you are. You qualify for Medicaid because of low income, low resources. So the state is actually offsetting some of your expenses. They could be paying for your Medicare B premium. You're saying they're covering your premium for your Advantage plan. So I would not make a move whatsoever. You have what's called dual SNP plan, dual eligibility, qualify for Medicare, Medicaid. So I would not go to a Medigap policy. You should stay right where you are. Okay, it's your birthday in July. You have until October. Okay, here we go. Learned this the hard way. Okay, New Hampshire here. Let's keep going. Trying to get to the Medigap. Okay, people, click the like button. Marvin is doing a great job. Hey, well, thank you, RG. That is kind of you. I appreciate that. All right, 3 months before your birthday, then your birthday month, and 3 months after your birthday, and that is true. That's enrolling into Medicare, A and B. Okay, they're abused by doctors too. Yeah. Total 7 months without penalty is still considered initial enrollment. Yes, it is. 3 months before, month up, 3 months after your 65th birthday. Now remember, you all, if your birthday falls on the first day of the month, you move the clock back one. So my birthday is July 1. That birth month is considered to be June. 3 months before June, and then 3 months after. If you're born on the second day thereafter, it's your birth month, 3 months either side of that. All right. Made referrals to Medicare school, confirmed to apply, was told I didn't qualify for referral. Well, I'll tell you what, Cindy, do me a favor. Would you call in 800, or you can call any of the 800 numbers, and would you ask to speak to Jennifer about that? She's our chief of operations, and so honestly, I can't answer that right now for sure, but just Cindy, call in and talk to Jennifer about that, okay? Please. She will help you. Okay, do you really think they're looking for fraud? I hope so. I don't know. I don't work with them, but I sure hope they're looking for fraud because there's a lot of it. Okay, our PHC Plan G does have a dental benefit, but it's expensive. Yeah, okay. Yeah, really what that is, just so you all know, it just means that United Healthcare is offering a standalone dental plan. It's not part of the G. Now, it may have been a part of the offering around the same time as you got the G plan, but it's really not with the G. It's not. It's a separate dental plan that United Healthcare offers. I think it's Delta Dental, basically. So I want to make sure you're clear on that one. There is a lot of Medicaid abuse. So totally agree to that. Okay, learning this the hard way, but you have to have A and B to get a supplemental. Exactly right. Yeah, you have to have A and B to get a supplemental plan, A and B to get an Advantage plan. Without A and B, you cannot have either. Okay, turned 65 in July, been on full disability since 2018. I'm on Advantage plan currently. I hate it. Can I switch to regular Medicare? Yes, you can. Let me explain, Jim. You're in what we call the IEP 2. You, at 2018, because of disability, had to make some decisions. I assume you're on a Advantage plan because you didn't know, or you're in a state that they didn't require supplemental plans to be offered. That's probably more likely what it is. Federal guidelines do not make states write supplemental plans for people that are on Medicare because of disability. We call those underage applicants. So that was you. So what's happening now that you're turning 65, you're going into your second IEP, IEP 2. Now you can reset the clock, Jim. You can get any supplemental plan. There's no extra charge for that. You get a normal 65 rate. There's no underwriting. They must cover your pre-existing conditions. But again, that's 6 months of your birth month. Okay, because you're not going to get a new B date, but because you have this IEP, the supplemental companies know that you're eligible with no underwriting. And Jim, call us, man. We'd love to help you through that and be your broker. And we'd do a good job for you too. Okay, here we go. Do you write for Transamerica? Good company. Ellis, earlier, and the answer was no, because we can't. Used to. I told somebody else about this. I was their number 2 agent in the whole country. Okay, I wrote lots of their plans. They were a company, but they went direct to the consumer. And so they don't work with agents anymore. I still see their prices. They're not very competitive in most markets. There's people that are more competitive, but still doesn't mean they're a bad company. They are, but you got to go direct. I'd rather have someone on my side, not just going direct. Okay, Jennifer, do you need to call your local office to find out if you're covered under the Social Security Fairness Act? Any updates? Okay, no, you don't. Okay, so for those of you that are unfamiliar with what she's saying, the windfall elimination provision, the government pension offset, is what the Fairness Act was all about. It only applies to about 3 million people in America, and these are those that had pensions that were coming from employers where there was no Social Security taxes paid on that income. And that would be, can be firefighters, police, sometimes teachers, nurses. So typically public service servant type positions. The answer is, if you are receiving a pension where there was no money paid into the Social Security system on that, then what's going to happen is once the government decides exactly how they're going to roll this out, then that reduction you got in Social Security because of this windfall elimination provision, government pension offset, which began back in 1983, they're going to drop that. So your Social Security check is going to automatically increase. All right. So again, if that doesn't describe you, it doesn't affect you. And so they say the only thing they want you to do is make sure that with your myssa.gov account, your address is up to date and your banking information is up to date. And that's it. So nothing else you have to do. I don't think I've heard exactly how they're going to roll that out yet. I do know it's going to be retroactive. People are going to get checks for all of 2024. So that's a nice little benefit. But if you didn't have that kind of a pension, you don't qualify. All right, Colorado. Husband turned 65 in November. Currently, both of us are on his company medical plan. Needs to sign up by November just for A. He will work through March 2026 and sign up for B and D. Okay, so let's go through this. I was going to work through March, so November, December, January, February. Okay, that's fine. Then he will come in for his B and his D under what we call an SEP, Special Enrollment Period. So it is fine for him to sign up for A as long as he doesn't have an HSA. So if you are not contributing to an HSA through his employer or some other way, then it's fine to do A. I'd recommend it. And then if he's going to work through March, he is outside of his initial enrollment period because birthday's in November. That'd be December, January, February. So then he's going to come in using an SEP, which is simple. You work with us, we'll show you how to do all that. But the employer is going to have to verify employment and insurance back to 65 for him to start then April 1. Okay, but he can do it. So what you're planning is just fine. By the way, we're going to make sure there's 20 employees or more on the payroll. Okay, yes, but you can sign up with the company and B, and they will do that along with the supplemental plan. Okay. Lasha, you're exactly right. We'll help you. Is Ace Chubb a good company? Ace Chubb is a fine company. They are owned by Chubb. Chubb is huge insurance company. Ace is their Medicare division. So the answer is yes. I would have no hesitancy being with them if they're competitive. And in many markets they are. I think they're a stable company. So I just want you all to know we're brokers. I mean, we write for Ace Chubb, we write for Aflac, we write for Cigna, we write for Anthem, Blue Cross, United Healthcare, Aetna. I mean, we write for Mutual of Omaha. I mean, on it goes. Okay, we're brokers. And so we don't have a favorite. What we have is we want to look at where you live, and let's look at the carrier that has a good market share there, because usually that's more stable rates, and that's competitive initially. So that's what we look at. But Ace Chubb is a fine company. Okay, I just applied for A and B last week. When can I get a supplemental plan now? Yes, right now. If you just applied, that means you're within your initial enrollment period for your Medicare, so probably within 3 months of starting. So you can apply any time now for your supplemental plan. And the sooner you do it, the better, because then that will go into effect when your Medicare A and B do as well. And we'd be delighted, Ruth, to help you with that wherever you are. We write business for multiple companies, and there's no cost at all for our services. And remember, folks, I've said it before, but the premiums are set by the insurance companies, not by us. So the price to you is always the same. Whether you go direct with a carrier or use a broker, whoever you use, the premium is always the same. Okay, 66. And have selected G plan via your organization. My employer's health plan expires 2/21/25. I have an HSA which will convert to an HSB after the 21st. Will I be able to contribute to the plan? Okay, well, let me tell you. You are asking me something I don't know. I don't know what an HSB is. I was aware of health reimbursement arrangements, but I don't know what an HSB is. So that's something that if you're our client, please call in and ask to speak to someone in our company and ask them your question, because I don't know. I wish I knew. I just don't know what an HSB is. Okay? Okay, so sorry about that. I am really sorry. That's a new one on me. All righty, here we go. It's 20% off a dentist price only on a list of dental offices. I don't know anybody good on them. Okay, must be something you all are talking about amongst yourself. Lush is right. We do everything for you. If you want us to, enroll you in a Medicare A and B, Social Security at the same time if you want, supplemental plans, drug plans, dental plans, anything. We are kind of a one-stop shop. Okay, does the company offer help with medical plans until I'm eligible for Medicare? And that is true. We do. And so if that's something that you need help with, just call in, tell our agent that your situation, and then that would be like a marketplace plan or an off-market plan. So yes is the answer. 95% of dentists are not good. Okay, here we go. Get basic G or basic N, not the ARP wellness G or N. Okay, and our G, I would tell you, I would agree with that in most cases, but I will tell you, I just had a lady recently that she did go with the United Healthcare ARP with wellness, and the reason was because she went to a gym. I'm not kidding you. Her gym membership was $100 a month, and UHC Renew Active covered it. So that was a good deal. But I would agree as a general rule, if you're not going to use the gym, a gym that it's not, or your gym is cheap, then I am agreed. Get the basic G or N without wellness. That wellness, the only benefit I think is really attractive is the gym membership for those who would use it, and if their gym membership is high. I think the little dental discounts, vision discounts, I'm not saying they're insignificant. It also has a 24/7 nurse line, but again, most people don't use that either. So I think you're right, but I have seen exceptions to that. All righty, here we go. Okay, good. I got the Plan G, loves it. I agree. Okay, switch to G immediately after finding out no dentist near me accepted at UHC was no help either. Okay, here we go. Anyone have any questions? You all are kind of talking among yourselves, which I'm great. I'm cool with all that. Okay, all right. Here, I like this one. What is your recommendation for people who live in New York State? Well, if you want to get a supplemental plan, I think an N is a very good option. Excess charges are very limited in New York. And plus, I think the premium difference between N and G is about $100 a month. So I think the majority of people, and we write a lot of business in New York, are getting N plans, get all the benefits of no networks and no referrals required, no pre-authorizations, all the beauty of that, but have a very reasonable premium on the N in the state of New York. All right. Okay, you familiar with the Tennessee plan for retired teachers? You know what? I am not. I know our agents are. But I would not be. But call in. They could talk about that. So if you want us to compare with you, we are happy to do that. And the agents would for sure. But I would not know that much about Tennessee, so I'm gonna have to pass on that question. Sorry about that. Okay. For me, it was almost $50 more, and that's very true on the G versus N. That can happen. Okay, what's the difference between N and G? Bonnie, well, N covers 4 of the 6 Medicare gaps. G covers 5 of the 6 Medicare gaps. So the gap that N does not cover is called excess charges. Does not happen often. Less than 5% of the time would we ever see it. So that's the difference. And then N has a couple of copays. See the doctor, specialist, whatever. You have a copay up to $20. Go to the emergency room, $50. So there's a little, tiny more risk involved with N than G. But again, it's very minimal. And so if there can be a $50 a month difference in premium or more, I'd be all over that N plan if it were me. Okay, if it's 30 or more, probably wouldn't. Okay. Here we go. Thank you, Marvin, for answering my question. You're doing a great job. Thank you for the encouragement. I wish I didn't have this annoying other thing you all mentioned. Okay, can I sign up for dental and vision for November, December 25 as I'm retiring by the end of October? I do have Medicare supplemental and drug plan helped by you. Yes, you can. And which is very good, Elizabeth, because then the companies will waive your waiting periods. So that is a very smart thing to do. So it's no problem at all. What we'd have to do is just take that employer plan, whoever the company is, and maybe the plan number, and submit it, and then you have immediate coverage on a dental plan. So that's a great idea. Okay, folks, my back is getting sore, and I'm getting tired. We've been at it now for an hour and 45 minutes. So I am going to take one more question. I'm sorry, but I'm worn out. Been up since 6, working, and my wife's going to have dinner. So I'm going to go, but let's answer this one. And you all, listen, we'll do it again next Thursday. I love doing this. And if those of you need help, call in. There's no cost for our service, so we'd be delighted to help you. All right, this is so confusing. Turned 65 in August. Wife is 13, my junior, and I'm on her insurance and will be for some time to come if I'm allowed to. Do I need to take B? Okay, so the answer is Phoenix Rising. As long as your wife is covered by an employer-provided plan that has 20 employees on the payroll, not the plan, at least 20 employees or more, then you don't have to do anything A or B. If you don't have an HSA you're contributing to, take A only. But if you have an HSA, do nothing. And then you can pick up B when she decides to retire. The key for you is this. You will be able to pick up B with no penalties and no problems as long as from the date that you turn 65, moving forward, just make sure you're covered by active employment insurance. Not COBRA, don't go without, have active employment insurance. You will be fine with A only. Okay? You'll be fine with nothing if you have an HSA. But if you have A only, you're fine. You'll pick up B, and that is called the special enrollment period. So if your wife's plan is very attractive financially, good coverage, you like it, and let's say it costs less than $200 a month to have you covered by the plan, then do nothing but maybe A only. That's it. So you're fine. Okay, folks, I got to call it. I am hurting. So listen, thanks so much. We'll see you either Monday night, 5 o'clock for the Facebook group, or next Thursday, same time. Have a great evening. Thanks a lot.